Hi, this is Dr. Christopher Maloney, naturopathic doctor. I want to talk about energetic fields. Energetic fields are some kind of esoteric woo-woo idea that basically someone can see auras, or someone can see, or someone can do and pass energy from hand to hand. And what's really important about that is that in terms of medicine, we know, we do EKGs, we know that the heart actually gives off electricity, we can check that electricity. We do EEGs, the brain also gives off electricity. We can do infrared scans of the human body. Infrared shows that there's heat given off from the human body. What happens is that when someone says, I can see basically your aura or your heat field with my visual eyes as opposed to using a machine, suddenly that leaves the range of medicine and becomes this incredible strange thing. And it seems perfectly reasonable to me that someone could see, that certain people can see things more sharply than others, and certain people could probably see a heat field coming off a person's body, and maybe that heat field might actually change color. I personally don't see it, but I have no difficulty in thinking that that might be helpful. I also don't think that that's the end-all or be-all, that someone seeing your heat field and saying you're now giving off blue doesn't necessarily mean that that's the best diagnostic treatment for you. I also don't think that if you are getting some kind of energetic treatment and it's not working for you, that is some of the end of the road. I think that there are a huge range of treatments within that field, and that in many cases, if someone has a deficiency in something, or if someone's experiencing a great deal of pain or other things, that wouldn't be effective. What I find most disturbing about the whole process of energy medicine is that it's treated as a completely separate entity than regular conventional medicine in most cases. And if it is treated as part of conventional medicine, it's done within a hospital setting, and a nurse being in a hospital setting. And I'd really like to see a continuity where energy practitioners are talking to conventional doctors, and conventional doctors are referring and cross-referring, because what's really important about all of this is that the patients get better. I don't care what you do, I want you to get better. And if you're not seeing that effect within conventional medicine, and then you're not seeing that within energetic medicine, many people will not coalesce or combine those two experiences and give themselves kind of an idea of what actually would work for them. And that, as somebody who sits on the edges of these things, I really find myself to be helpful in that case to coalesce and integrate the two experiences, so the person has a kind of a continuity, a storyline that actually goes between the conventional and energetic worlds.